I'm Terzel Vasquez, Stat Brand Studio producer. Today I'm joined by two leaders from Gilead and Kite, a Gilead company. Dr. Mika Kakafuda Durink, Senior Vice President, Therapeutic Area Head Oncology at Gilead Sciences, and Dr. Galia Levy, Senior Vice President and Global Head of Development at Kite. Thank you both for being here for this sponsored conversation.
It's a pleasure, Terzel.
Thanks so much for having us, Terzel. It's great to be here.
Gilead and Kite have a clear and bold ambition in oncology. Could you start by telling us what underpins this ambition and what sets your approach apart in addressing some of cancer's toughest frontiers?
At Gilead and Kite, our ambition in oncology is profoundly rooted in the urgent needs of patients. Everything we do is driven by this patient-first approach. What sets us apart is our unique and complementary strength across two transformative platforms: Gilead's leadership in antibody-drug conjugates, or ADCs, and Kite's pioneering work in CAR T-cell therapies. They create a powerful and comprehensive and rapidly expanding differentiated pipeline that is now our most robust and diverse to date. This allows us to relentlessly pursue solutions for diseases with the highest unmet needs, pushing beyond incremental advances to deliver meaningful change for people facing cancer. Our scientists are advancing precision biological approaches that aim to very selectively kill cancer cells with minimal impact on healthy tissue.
I want to build on Mika's excellent points about precision biological approaches. At Kite, our groundbreaking work in CAR T-cell therapies represents a truly transformative, personalized medicine. We're driven by a relentless mission that reflects Gilead's overarching commitment, as we really aim to be best in disease, advancing the science of cell therapy by innovating beyond even our own current breakthroughs. The critical integration of technologies from Arcellx, Interius, and others is vital for us to further expand and solidify our leadership in CAR T-cell therapy. This ensures we can reach even more patients with these potentially life-changing treatments and explore new frontiers in cell therapy.
Galia, Kite's leadership in CAR T is remarkable, having treated tens of thousands of patients globally. Beyond the groundbreaking science, what does Kite do to ensure these complex, transformative therapies reach the patients who need them the most?
We've now treated over 34,500 patients worldwide with our cell therapies. That's the most patients treated out of any CAR T company. So these are encouraging numbers, right? But we still have a lot of work to do to ensure more patients can access this potentially curative therapy. Unfortunately, today, only about 2 out of 10 eligible patients obtain CAR T. And one of our top priorities is actively working to improve the CAR T ecosystem so that more eligible patients can have access. So to do this, we're continuously working to expand the number of authorized treatment centers for Kite, which currently stands at 600 worldwide, while also working to bring CAR T closer to the community. Finally, for patients to realize the potential full benefit of CAR T, they need to receive it in a timely manner. So rapid and reliable manufacturing and delivery are critical. At Kite, we're the only CAR T company that has a fully integrated cell therapy manufacturing network. So that means we manufacture each and every dose in-house. And that enables us to maintain an industry-leading 96% manufacturing success rate and some of the fastest turnaround times in the industry for our currently approved CAR Ts.
Mika, Galia, you represent a powerful combination of organizational capabilities. How does the combined strength of Gilead's ADC expertise and Kite's cell therapy leadership create a unique advantage in tackling cancer? And what does Gilead's long-standing legacy of trusted scientific innovation bring to the oncology space?
It really is a powerful combination, Terzel. Antibody-drug conjugates are designed to target cancer cells while minimizing impact on healthy tissues. We've already had success with an ADC, and we're building on that by investing in next-generation ADCs that we hope will be more potent and designed to have even a more favorable safety profile. And with our acquisition of Tubulis, we are further strengthening our ADC platform, adding potentially best-in-class assets and next-generation technology. This move, combined with our existing leadership and pipeline, solidifies our position as a trusted company in ADCs, which is incredibly important as we look ahead to future innovations. Together, Gilead and Kite's experience in ADCs and cell therapies gives us a differentiated advantage, We're not limited to a single modality or a single tumor type. We can pursue the right technology for the right biology across both solid tumors and hematologic cancers. Our long-standing legacy at Gilead, built over decades through breakthrough science in areas like HIV and viral hepatitis, means we bring an unparalleled commitment to solving complex challenges with novel solutions.
One of the clearest examples of that is our work to expand cell therapy beyond blood cancers and into solid tumors. So, as an example, in recurrent glioblastoma, we're exploring multi-targeted armored CAR T approaches in what is one of the most challenging settings in oncology. So, from Kite's perspective, Gilead's legacy, infrastructure, and expertise are truly invaluable. It allows us to operate with the agility of a biotech, constantly innovating and pushing the boundaries of cell therapy. But we're backed by Gilead's immense resources, and we collaborate very closely with the scientists and physicians working in oncology at Gilead. This allows us to really accelerate our research and broaden our reach significantly.
Dr. Mika Kakafuta-Durink, Dr. Galia Levy, thank you both for this insightful conversation about the future of cancer care. Where can our listeners find more information about the work Gilead Sciences and Kite are doing?
Thanks so much for having us, Terzel.
It was a pleasure being able to dive into these topics with you. Listeners can learn more about our commitment to transforming cancer care and Kite's innovative pipeline by visiting gilead.com.
Thank you again to Mika and Galia for joining us, and thank you to our listeners for tuning into this very special sponsored conversation.